Good evening. My name is Bridgette Baker, and I'll be your webinar producer for this evening's event. I'm pleased to introduce the National Coalition of 100 Black Women, Inc.'s National President, Elizabeth A. Jones.
Good evening. It is my pleasure to bring greetings on behalf of the National Directorate and the members of the National Coalition of 100 Black Women, Incorporated. NCBW is a 41-year-old nonprofit advocacy organization comprised of activist women in 61 chapters in 26 states and the District of Columbia. Our mission is to advocate on behalf of Black women and girls to promote gender equity and leadership in the areas of health, education, and economic empowerment. I welcome you to tonight's webinar, where we will learn about myeloma and its impact in the Black community. To our sponsor and partner, the Leukemia and Lymphoma Society, LLS, thank you for making tonight's webinar possible. I am honored to introduce the National Coalition of 100 Black Women, Incorporated National First Vice President of Programs, Mrs. Minnie Miller. Ms. Miller is a member of the Metropolitan Atlanta chapter and has served NCBW at the local and national levels for over 25 years. Members and guests, First Vice President Minnie Miller.
Thank you, Madam President, and good evening, everyone. It is so good to be with you this evening. It is my pleasure to introduce to you our chair of the National Health Committee, not education, and also she is going to be the one that will be the moderator for our program this evening. Mia is a speaker, published author, consultant, therapist, and an ordained minister with a personal mission of empowering others to live life on purpose by making the most of every opportunity for social and economic development. Mia holds a BS degree in psychology, counseling concentration, and a master's in professional counseling. Mia is currently pursuing her doctorate degree in Christian psychology and is a licensed clinical member and certified pastoral counsel, and is a certified and licensed temperament therapist. Mia has more than 15 years of professional experience in professional counseling and management of a government agency in Texas. Currently, she is the National Community Outreach Manager for the Leukemia and Lymphoma Society's Myeloma Link program, a national program that provides education and outreach initiatives that directly connects Black patients and caregivers to trusted, free myeloma information and support, and enhances access to care and the latest treatment. Additionally, she is the organizing leader and the chartering president of the National Coalition of 100 Black Women, Incorporated, Dallas Metropolitan Chapter. And she serves as the national chair for our health committee. And she is an elected member of the National Nominating Committee and is currently in our 13-month Lead Academy program. Following this brief video, we will turn the webinar over to Chair Johnson Turner.
So I went to the doctor. He came in and he was like, "Hey, how you doing, Mr. Gilbert?" And I was expecting, like to sit down. There's a psychologist or psychiatrist there, somebody to brace your fall or in case you go crazy, snap out, brace yourself type moment. But he was, he was very, he looked very happy. So I thought maybe I was good. And so he said, "Hey, remember that cancer, that nasty cancer we were discussing prior to the biopsy? I was like, yeah. He said, well, unfortunately, you have it.
One thing that Leukemia and Lymphoma Society helps with is not only helping the patient say, hey, this is your cancer, this is what you need to do, this is your treatment, but it also has a section to say, hey, you're the family member, you're the caregiver. This is how you take care of a person with multiple myeloma. This is how, this is what they should eat, what they shouldn't eat. Some of the things that you wouldn't necessarily think about, or there's things that I'm not necessarily prescribing on my prescription pad, but things that definitely mean the world of a difference to somebody who's newly diagnosed with this disease.
I have multiple myeloma. I was diagnosed with that in 2017, the day after Christmas. Kept getting more sick and more sick. And all the doctors were telling me I was fine, and I knew I wasn't fine because I've never been really sick in my life. Cold, flu maybe. I've got, God knows the irony, I've never broken a bone, even though I have bone marrow cancer. No major surgeries, so I knew something was wrong. And I went through 3 primary doctors, and they all just kept saying I was a hypochondriac. There's been a stigma that's been put on us through the years, especially black men. Going to the doctors or even speaking about mental issues, was considered soft or not manly, and I grew up in that same era. That's completely false. I mean, they're so wrong on that. They're just so wrong on that. That would be one of the first things that I'd like to acknowledge, is that it's very important, no matter what ethnicity you are, to take care of yourself, mentally, spiritually, and physically.
Thank you, Madam National President Jones, and thank you, Madam National First Vice President Miller. My name is Mia Johnson-Turner, and I serve as the National Health Chair for the National Coalition of 100 Black Women Incorporated. Additionally, I'm the National Community Outreach Manager for the Myeloma Link program at the Leukemia and Lymphoma Society. In my role, I establish national community partnerships and I manage LLS's efforts to serve and support historically underserved populations. Through Myeloma Link, we help patients and community members enhance their knowledge about blood cancers, cancer racial disparities, and clinical trials, among other topics. So this is a great opportunity for us to segue into our topic. The video that we just saw is perfect, as we're going to be talking about myeloma and its impact in the Black community. Tonight, we're going to hear from a myeloma specialist, a patient, and a caregiver, and we'll learn more about how this type of blood cancer affects our community and the resources available to support those diagnosed with the disease. Now, let me introduce to you our esteemed speakers for the evening. Dr. Adrienne Phillips is an associate professor of clinical medicine at Cornell Medical College and associate attending physician at the New York Presbyterian Hospital. Dr. Phillips graduated from Brown University with a bachelor's degree in human biology and Latin American studies and a medical degree with honors. She holds a master's of public health degree from Harvard University. She then moved to New York City, where she received both her internal medicine training and fellowship in hematology oncology at New York Presbyterian Hospital, Columbia University Medical Center. She is now an associate professor of clinical medicine at New York Presbyterian Hospital, Cornell Medicine. Her research has been presented at national and international conferences, and she has co-authored numerous publications. Dr. Phillips is a member of the American Society of Clinical Oncology, the American Society of Hematology, and the National Medical Association. Thank you for being here. Then we're going to introduce Otis J. Wilson Jr. Otis has over 20 years of experience in the pharmaceutical industry in various roles, but the most important experience he possesses is being a cancer survivor of myeloma since 2018. As a survivor, he has taken this experience and has used it in the real world to support patients through the journey of treatment and access to support services. Otis received a Bachelor of Arts in Organizational Communications from Murray State University in 2001. He's also a life member of Kappa Alpha Psi Fraternity, Inc., and also joined the Divine Organization as a student at Murray State, where he was on a scholarship as a basketball player. He is married to his beautiful wife, Tracy, for the last 15 years, and they have 2 beautiful children together. Thank you so much for being here tonight. And we also have Dr. Tracy Wilson. This is also Otis's wife. She's the caregiver to her husband, Otis. And Dr. Wilson has a doctorate in nursing practice. She also has a postmasterate graduate certificate from the University of Kentucky and is a board certified family nurse practitioner. In addition to this, she also has a Master of Science in Nursing Education. She's received her Bachelor of Science in Nursing degree from the University of Louisville. And most recently, like in the last couple of weeks, Dr. Wilson has earned her Master of Science in Bioethics and Medical Humanities from Tulane University School of Medicine. Wow, we thank you all for being here tonight. And so we're going to kick off our discussion tonight with Dr. Phillips. So Dr. Phillips, what exactly is myeloma?
Oh, thank you for that question, Mia. And I'd first like to thank the National Coalition of 100 Black Women and the Leukemia Lymphoma Society for inviting me here for this program this evening. So multiple myeloma is a cancer of a particular type of white blood cell called a plasma cell. And normally plasma cells make proteins, or the medical term for these proteins are immunoglobulins. And these proteins help us fight infection. But in multiple myeloma, the plasma cells are cancerous and they make these proteins uncontrollably. They make too many of the proteins. The proteins don't work effectively. And these proteins can deposit in various parts of the body and wreak havoc. So if they deposit in the bone, you could have bone fractures or bone problems. You can have calcium released into the blood from deposition in the bones. You can become anemic. These proteins can deposit in the kidneys, so you can develop kidney problems. And like I said, even though these are white blood cells making proteins, they don't work well, and frequently myeloma patients have problems with infections.
Interesting. Okay, so then you mentioned what some of the infections and what some of the patients go through. Can you tell me what some of the symptoms outside of what you just explained, what some of those symptoms and risk factors are when associated with multiple myeloma?
Sure. So I'll start first with the symptoms. You know, in medical school, we learn mnemonics to help us remember the signs and symptoms of various things. So the mnemonic to recall for multiple myeloma is CRAB, or C-R-A-B. So the C stands for calcium. So you can have elevated calcium levels, and symptoms of elevated calcium can be confusion, generally just feeling weak and tired, constipation. You could have problems with your heart if your calcium levels are off. So those would be symptoms related to the calcium. R stands for renal, or your kidneys. So people who have kidney disease could have swollen ankles, or, you know, on their blood work, have elevated kidney function tests. The A stands for anemia. So when you're anemic, you feel tired and fatigued. And then lastly, the B is for bone, and the bone problems or symptoms people can have relate to bone fractures or weakened bones. You can have back pain and easily fracture bones. So those would be some of the signs and symptoms. In terms of risk factors, unfortunately, many of the risk factors for myeloma we can't readily control. So it's a disease of older people. So as you get older, you are more likely to get many types of cancers, but age is a risk factor for myeloma. Race is also a risk factor for myeloma. So we obviously can't control being African-American, but it's something we're doing this program tonight to learn about, you know, what we are at higher risk for developing. Some other risk factors would include obesity or being overweight. So certainly we can try and modify that. And then lastly, there's a pre-myeloma condition called MGUS. I'll just abbreviate it like that. And sometimes when you go to your doctor, you can be checked for proteins that might be slightly elevated, but they're not depositing in those CRAB parts of the body. So MGUS is a condition that can predispose you to myeloma that you can be checked for.
Okay. So you mentioned earlier about a risk factor that we can't change, which is, of course, being African American or Black. So can you tell us how myeloma impacts the Black community or African American community, and why it is important for our community to know about this disease?
Absolutely. So many of the blood cancers are actually less common in the Black community, but multiple myeloma is the most common blood cancer in our community, and it occurs at rates that are like 2 to 1. So we're twice as likely to get multiple myeloma compared to white Americans. And this rate is actually higher than some cancers you kind of think about in the Black community. This is a higher risk than prostate cancer, which certainly is high amongst our men. And then the other issue that we need to be concerned about with multiple myeloma in our community is that unfortunately many people with myeloma can be diagnosed late and not be offered proper treatments. And I'm a bone marrow transplant doctor here in New York City, and we time and time again see patients referred to us for different treatments for bone marrow transplants later in their course when these treatments might not be as effective. So again, why we're doing this program tonight.
Okay, so you mentioned diagnosis. If someone or when someone is diagnosed with myeloma, what is the first thing that they should do?
So I would say the first thing is don't freak out. Obviously, it's a cancer. You're very worried and concerned, but I know I look young, but I've actually been practicing for about 20 years, and there are so many new treatments for multiple myeloma that it is not a death sentence. You can live a good quality of life when you're getting treatment for myeloma. So I would say the first thing is don't freak out, but you need to find a good myeloma specialist. And specialists for myeloma are hematologists, and certainly there are hematologists, at least here in New York City, that only see myeloma. There might be hematologists across the country that might see also prostate cancer and lung cancer. I would say if you can see a hematologist who has expertise in myeloma, that would do you well.
Okay, and once diagnosed, and when they do see their specialist, hematologist, what is the traditional course of treatment for this?
So unfortunately, there's no one size fits all or one prescription that every myeloma patient is going to get. And it's really important that you don't compare your or your family members' treatment program with someone else's, because everyone is very different. We're learning a lot about the science of myeloma that can help us treat people with different mutations in a different way. So it can really vary. Some people actually might not be treated initially for the first few weeks, and maybe they'll just be watched. Then obviously we have chemotherapy, we have immunotherapy, we have antibody therapy. These forms of treatments come as intravenous injections, they come as pills. So a lot of the cocktails kind of have different components, and each patient is going to perhaps be on a different cocktail. But generally, it will involve chemotherapy, immunotherapy, and then sometimes transplant.
Now, what about clinical trials? This is something that I talk about anytime I am traveling, presenting or doing anything regarding myeloma. And we talk about clinical trials because this is that taboo topic for the Black community, and people are very concerned when we start talking about clinical trials. Is this something that myeloma patients, given the history and some of the skepticism that's associated, should be discussing with their physicians, and how do they go about doing that, although they may have those reservations?
Right. So absolutely, clinical trials are important for any kind of medical condition. But the reason why people with myeloma are living longer and with good quality of life is because we conducted clinical trials that show that new treatments are effective. And unfortunately, even though this disease is most common in African Americans, we don't participate for, as you mentioned, perhaps valid reasons on clinical trials. But the only way we're going to get access to these new and effective treatments is if we participate on trials. And certainly, without giving, a big soliloquy on trials, there are different phases of clinical trials, there are observational trials, there are treatment trials. So you definitely want to get information on the trials available to you. And I would say, if you can't talk to your hematologist oncologist about your concerns, then that's probably not the right hematologist oncologist for you. So I would bring up your concerns and feel comfortable with your doctor. And if there are trials available, that's really how we're going to make progress in this disease for our community.
So it sounds like you're saying that myeloma, there are a lot of great prognosis, and we're going to hear from a survivor in just a moment. There's great prognosis, but I have, one more question in terms of just myeloma and the longevity of it. Like, is it curable? Is this something that you can go through the treatment and say, okay, now I don't have myeloma anymore?
Yeah.
Or tell me a little bit about that.
So unfortunately, multiple myeloma is not curable, but you can certainly go through treatment and say you don't have multiple myeloma right now. It's not active. We're able to put it into remission, so kind of see no evidence of it in your body for many years and going on decades. And when people come to see me and they're nervous and anxious, I think about diseases like diabetes and hypertension, which we also don't have cures for, but we can put people on very well tolerated in myeloma, what's called maintenance therapies to help them live, again, decades, good quality of life, and we can keep them in remissions that are very long lasting. And then who knows, maybe you can participate in a clinical trial where, 20 years from now, we will say it's curable.
Great. Thank you for this valuable information. We appreciate you sharing that. And now, speaking about our survivor and his amazing wife, following this video, we're going to talk to Otis Wilson and his wife, Tracy. And Otis will share his story as a myeloma patient and his journey with the disease. And then Tracy's also going to speak to us about her role as a spouse and a caregiver to Otis.
In like a couple months, it went from I'm a hypochondriac and nobody knows what's wrong with me to being diagnosed with multiple myeloma.
Multiple myeloma is primarily a bone marrow cancer. What's surrounding the marrow is the bones. So as it's kind of making its way out of the marrow, unfortunately, it really attacks those bones.
Your bones are impacted. They become brittle or not as resilient to injury.
We only get one body, and you want to try to keep all the original parts as long as you can. There's wonders that they can do in medicine, but there's nothing like having your original parts.
What we don't share is killing us.
We talk about things that are sports related or entertainment, things that are news. Healthcare is not necessarily one of those things.
As far as in the African American community, it's important to understand that multiple myeloma, as rare as it is, and I'd never heard of it in my life until now, it affects us like a 2-to-1 ratio as opposed to, Caucasian folks.
The LLS is a resource that can guide you in that direction to help you, kind of figure out, what I should be eating. How do I keep from being such a burden on my caregivers? It'll disrupt their life as well. Just a lot of things that you don't think about until you're diagnosed, and they have answers.
Otis, thank you so much for joining us this evening. Really appreciate you being here to share your story. So if you don't mind, take us back to before you were diagnosed with myeloma. Did you know, or did you feel something wasn't right, or were you caught off guard?
Yeah, for myself, number one, thank you all so much for allowing me to get on and speak with you all for a few moments about this very important topic. Prior to me knowing or finding out, the interesting thing is in the video, the gentleman, he actually found out about 4 days before I did that he had multiple myeloma in December of 2017. And so for myself, I had no idea at all. It literally was one of those things where I was going through some issues with my back. It started out for me as I was traveling quite a bit for a job that I was holding down. And I kind of attributed, the pain that I was having in my lower back to being in a different hotel every night on airplanes. And I went to go see my doctor about it. He gave me a referral to go speak to another doctor that was saying that, oh, the back pain is, let's give you pain pills to start. So it started with, giving you the Vicodins and things like that. Then the pain wouldn't go away and it started to radiate not only from my lower back, but down my right leg. So at that point, they started putting me through physical therapy, all of those things, getting put on machines that were bending me and stretching me and cracking me and doing all of these things, and started getting steroid injections after that. The pain just never really would subside. And then I went to another doctor and he told me that I had an issue with a disc in my lower back and that was causing all the pain. And once I got surgery, that it would all just kind of magically go away. And so I went under the knife and got a back surgery. And immediately afterwards, the pain, of course, did not go away. And he was like, oh, let's just put some more pain medication on top of it and wait. But once you heal in a couple months, it'll all get better. Well, needless to say, that did not happen. And it was really by God's grace and accident that I found out that I had multiple myeloma. I went on a vacation with some friends to the Dominican Republic. And in the Dominican Republic, we ate some food that really didn't agree with our bodies too much. And I made it back home and I had salmonella poisoning. Well, I had no idea. I was just at home sick for a few days. And my wife and I and our daughter, we were actually on our way to church on a Sunday morning. And my wife was like, let's just go ahead and go to the hospital and figure out what's going on because I wasn't feeling any better. Well, in the hospital, they gave me an IV, did some blood work. They came in the room and they were like, oh, your white blood cell count looks a little low, but it's probably just because of the infection that your body is fighting. It should not really be anything that big of a deal, but I want you to see your primary care doctor. So go ahead, just a couple days, saw my primary care doctor. My white blood cell count was even lower. He says, it's no big deal. Your body is just fighting an infection, but I want you to kind of just go see a hematologist, oncologist. It'll be no big deal. Just go see him and let's, just get it checked out. Well, that was in May of 2018. And in the end of, May of 2017. And it took all the way from May until the end of December, right before Christmas, or right after Christmas, right before New Year's, to let me know that I had multiple myeloma. They were doing testing on me every couple of weeks and poking and prodding and this x-ray, that, and PET scans and everything else. And it took about 6 months before my doctor told me that I had multiple myeloma. And he told me it was because I was so young that he was afraid that, that was the positive diagnosis. So, I went out for multiple opinions. He sent me out and finally they told me at that time that I had it.
So, wow, that's a lot. Let me just say, you sharing your story, that is a lot in the progression of going from just traveling to, okay, no, this is really multiple myeloma and I'm really young. Did you know anything about myeloma before your diagnosis?
I knew absolutely zero about multiple myeloma before I got diagnosed, and I worked for a drug company. So, and it was a interesting thing, but one of the things that when I found out what I had, the good thing was I was lucky enough that my company makes a drug for multiple myeloma, multiple drugs for it. and is very big in oncology. So I started reaching out to friends of mine who worked in like corporate headquarters, and I literally was emailing people online that worked for my company, and I was able to get some information, from them. So that was a good thing. And then it didn't hurt that I have a wife that's a healthcare provider and had a lot of contacts as well.
So take me to how you handled the news and how you prepared yourself mentally for the treatment process.
Yeah, so for me, how I handled the news is I kind of feel like I was kind of stoic. And I think it was more because of when I was told. We were actually leaving that very morning to take our children to Disney World for New Year's. And so we had a flight out early afternoon, and I had a doctor's appointment like 8 a.m. And they literally just walk in the room and say, hey, this is what's going on with you. This is what you got. We want you to start chemo tomorrow. And I'm just kind of like, okay. My wife wasn't at the appointment with me. I was there by myself. So immediately things start going through your head. No, I can't start chemo tomorrow because I'm taking my family out of town on a trip. Number two, you want me to start tomorrow, and I don't even know how in the world I'm going to tell my wife or when I'm going to tell my wife, because do I want to ruin a vacation by letting my wife know this information, or do I hold this back until, we come back? The doctor reluctantly did agree to let me go on the vacation. He said, you can go ahead and go, but you must start immediately after you got home. And they were very serious. As soon as I got home, I had to start. So I was very kind of stoic about it, but then it really started hitting me once it got into the point of like, we had a newborn son at the time that was very, very young. I was so young. It didn't run in my family. How do I tell my parents? It was just so, am I going to be here in 5 years to be able to share anything with my family? Am I, to be very, very blunt, am I going to die? Those are the types of things that started going through my mind. And quite honestly, if it had not been for getting personal therapy, seeing a therapist on a very, very regular basis right after I got diagnosed, I probably would have drove myself and my wife crazy.
Wow. So then when you're talking about the treatment, because I heard you say that your doctor was adamant, you have to start when you get back. So I know you were probably on the trip and, mine was here and there and asking yourself those questions as you just mentioned, and then you get back and jump right back into treatment. What was that treatment process like?
Yeah, so immediately right off the bat, very, very first day, of course, you talk about the multiple medications that you have to take. Actually, as soon as I get done with my call, I have to take my last dose of Revlimid for the month. I still take it. So Revlimid, dexamethasone, Velcade is what they put me on. I would tell people that not a fun process. Velcade, I still take medication to this day because I now have neuropathy in my feet. And if I don't take my pregabalin, which is what I take for it, literally, I feel like I'm kind of walking on glass by about 10 or 11 o'clock in the morning if I haven't taken it. I got a stem cell transplant, so of course I had to do the months of the chemo, and then of course I got my transplant in August of that year, so I had to do the hardcore chemo like the melphalan and all those different things where cause your hair to fall out, lose all your eyelash, all that great stuff. I went through that whole thing and everything, but I almost want to say that the buildup to what I felt was the big thing, like the transplant, was very, very, for me, it was very difficult because my doctor was he's one of those doctors who's very strict on my diet. Like, I don't want you to do this. I want you to make sure you stay as active as you possibly can because you're going to need the energy to be able to handle this. And he used to say, the fact that you're young, I was just 40 years old. The fact that you're young, you work out, you do those things are going to help you a lot. And he was very, very blunt with me on those types of situations. But then I had a complication in the middle of it before I even got to transplant because He decided not to put me on a bone targeting agent. And I mean, just all kinds of different things happened. And it made the journey a lot more difficult, but it made me as a person look at life completely different.
Wow. You have shared a lot in terms of the treatment. I mean, and I talk about this, you know, in what I do with LLS quite a bit, but have not had the chance to just sit and speak with somebody about just what it was like for them personally, like the entire, you know, phase and the step-by-step phase of what it was like for them, both physically and mentally, to be diagnosed and to go through the treatment process. And you have certainly shared that you definitely had to do therapy. That was major, but you also talked about your lovely wife. And so I appreciate you and thank you for sharing your testimonial. And because I'm sure that those who are myeloma patients in the audience or caregivers can relate to your story. And so now that we've spoken of your lovely wife, Dr. Tracy, we're going to hear from her today. And she's been your companion and your partner throughout this process. We're thrilled to have her here. I say she's my friend, but you know, that's us talking. I enjoy hearing her story. I'm going to try not to cry when she tells you all about it. So thank you tonight, Tracy, for being here with us. It's obvious that caregivers must be patient and have a heart to care for others. And so you're not only Otis's wife, but we're also very instrumental in ensuring that he received the care that he needed. So you both navigated this myeloma journey together. And I want to ask you, what type of support did you rely on to fulfill your role as the caregiver?
Well, thank you. Thank you all for allowing us to be here and share our story. I would say, first of all, I would have to say God. If it had not been for him, I don't know how we would have managed to get through it. I would say the next thing was family. So as he stated, you know, we, you know, found out the news, you know, and when he went to have his stem cell transplant, he had to go into quarantine. And so we could not, when they told us how things were going to go, we could not stay at the house because we had young children. And so because his complete immune system was wiped completely out. So, you know, children, gotta love them, but they're incubators of the plague. So we had to go and stay at a hotel. And so we had to rely on friends and family to help basically we had two headquarters. So we had the quarantine, which is where he was, and then we had our house. So we had people, you know, my mom and friends and family coming in to stay not only with the kids, but then we had people that were coming in to help also come and stay with him. So I stayed for I think it was about a week and almost 2 weeks with him. And then we also had people that then rotated in and stayed a week, you know, maybe 2 or 3 days, you know, time frame with him. I would say another thing that was such a blessing as well too is him being a member of Kappa Alpha Psi. When I say them brothers came and showed out, they showed out. One of the brothers there actually created a food train, not only for the house, but for us at the hotel, and did that for the entire time that he was in quarantine. So that was the other thing. So I would say God, family, friends, and then Alpha Psi. I would say that's what got us through.
It sounds like you had an amazing network, just an amazing set of friends, family, organizational brotherhood, just an amazing amount of support, which is really, really big in the Black community. You know, we go through stuff and we rely on one another quite a bit to kind of get through, especially, you know, diagnoses such as cancer. But even with like having all of that type of support and family and friends, it can be overwhelming. It can be overwhelming. It can be exhausting. And so what would you say, how did you, you know, self-care, how did you replenish yourself with it being overwhelming and feeling the exhaustion? And what would you say to other Black caregivers who maybe you right now in the shoes that you were in and who may be feeling just as overwhelmed as you were feeling at that time, just as exhausted as you were feeling at that time? What would you say to them?
I would say you just hit the nail on the head. I would say self-care. You cannot forget about yourself. You cannot, because just as they're in the thick of it, just as they're feeling, you know what I mean, they're, you know what I mean, they're having the questions, you know what I mean, they're not talking, you know what I mean, they're getting the therapy, they're feeding, and you're feeding into them. You're giving all of yourself into your loved one. You have to find that opportunity in that time to give it back to yourself. So if it's just that little quiet moment, you know what I mean, where you go on a walk, you know what I mean, whatever that looks like for you, you know what I mean, if it's, you know what I mean, if it's praying time, if it's walking, if it's, you know, retail therapy, whatever that is, that gives you that little bit of solace, do that. I also did therapy myself during that time. So I would say whatever it is that makes you happy, that gives you that little piece of joy, I would say that. And I would also 1000%, I would say therapy, because you need somehow to get some of that out that, you know, again, you know what I mean, as he was saying that, you know, all of those thoughts and those feelings that he had, I had just those same thoughts and those feelings out. Some of that time, he wasn't the nicest person. Couldn't tell him that he wasn't nice. That wouldn't been polite. I needed a place to go tell somebody he ain't being nice. So I needed a place to be able to vent that kind of information. So again, we both had our safe place to be able to communicate that information.
I'm glad you mentioned therapy, because again, you know, with the Black community, sometimes that can be taboo of a topic. And coincidentally, this is the last day of the month for Mental Health Awareness Month. And so that's just a plug. Take care of yourself mentally. And you're able to say how you both were coexisting in the same world, but both having to deal with the emotions from different perspectives of that same diagnosis. And one of the things that I very, very distinctly remember you saying, and one of the other times I've heard you tell your story, is that you just had a baby. You had like a new baby as well. So it's wife, it's mom of babies of different age, it's caregiver, it's Dr. Tracy. It's a lot going on, right? And so I can appreciate you, you know, really pushing the need for not just the physical health and the support that's needed for the family, but the mental piece of it as well. And so I appreciate that. I have one more question for you. You getting involved with LLS, how has that helped you cope in certain times with your role as a caregiver?
For me, LLS, for me, one has been a part of activating my voice within this community, and bringing the awareness. Because again, as my husband said, we don't know. So finding this, and you know, and again, I'll remind you, you know what I mean, I told you how I even found you all. I'm at a conference, you know what I mean, because a part of my job, I attend conferences. And so I'm walking through a conference in Atlanta, and I'm literally walking past and I see this big, beautiful red booth.
Mm-hmm.
with the name on it. And my eyes literally light up because I see a place and I see this name and I'm like, what is this place and how can I be involved? Because it actually has something to do with something that I'm very passionate about and I deal with on a daily basis because of what I'm dealing with my husband. And so it instantly made me activated and want to lend my voice to the cause. So for me, that's why I wanted to be a part of it. And I think because of, again, my personal reasons, I think that's the reason why we need the awareness. And I think what Dr. Phillips shared, we see the health disparities. Me being a healthcare provider, me having my husband, my grandmother passed away from it. We need more people out there in the communities talking about it. We have too many people suffering from this that look like us. We need more voices. So that's why.
Well, I can say that I'm very, very happy to be able to work along your side. And you know, you and I can continue to chat and have this conversation and just pretend like we're allowing the National Coalition of 100 Black Women to sit in on our conversation, because this is what we do. You know, this is what we do. So I definitely do appreciate it. And at this moment, I am going to turn this back over into the hands of our National First Vice President, Minnie Miller.
Thank you so much, Chair Miller, and thank you, our presenters, Dr. Phillips, Mr. Otis Wilson, and Dr. Tracy Wilson. What a phenomenal presentation. I tell you, I am just in awe. I've learned so much this evening, and I believe that our members have done so as well. I have seen from the chat where they have been just chatting the entire time about what a great and informative session this was. We are just so grateful that you shared with us. And we know because of this webinar tonight and for the information that you shared with us, this is going to certainly help us and our community. We know that as Chair Meir said, we always want to take care of ourselves, but it is also good to have that village. And also when you know and hear from people who have been in that position, it certainly helps us. So again, I want to thank you again, Dr. Phillips, again, Mr. Otis Wilson, as well as his lovely wife, Dr. Tracy Wilson, for just being here with our members tonight and sharing your stories that's going to help impact our Black community. And now I am going to turn it back over to our chair of health, Mia, and see, I believe we may have time, Mia, for some questions. If we have a few questions, I'll turn it back over to you if you want to take a few questions, and if not, we will turn it back over to you for your closing remarks.
All right, yes, ma'am. So let's take a couple of questions and let me look over in the chat. I know that I have a couple of my health committee members who are going to be sending me some of the messages or some of the questions. I do have a couple that's already here. One of them I see is for Dr. Phillips. Is there a genetic link?
No, not one that's been discovered yet, but certainly we know about families that have either that MGUS pre-myeloma condition or multiple members of the family that have myeloma. We definitely see patterns, but the gene has yet to be discovered.
Okay. And what are some of the tests we may be able to advocate for if doctors do not seem to be proactive after seeing high blood platelet count. And I think this is JAK. I'm not really sure what that is to me, to mutation.
So there's no one blood test that can diagnose multiple myeloma, and I'm sure Otis and his wife can comment on bone marrow biopsies and perhaps anxiety going through those diagnostic procedures. But certainly there are blood tests like your blood counts. If you're anemic, that's going to show up there. Your chemistries, I mentioned the calcium level, the kidney function. There's something called the M protein, which you can check on a test called an SPEP. You can check for protein in your urine. So I guess if I was going to say one thing to advocate for, if you're concerned that it could be going on, if you say M protein, I think your doctor should know what that is and can send the right test, or at least refer you to where it can be done.
Okay. And looks like we have one for both Mr. Otis and Dr. Tracy. Either one of you can answer this one. The ladies want to know, how did your wife respond when you told her after the vacation?
So he's had to drop off the call, but as far as once he told me, I guess, the actual diagnosis, so the trip, when he told me, and he actually told me that day, and it was, I think I knew, but it was devastating, to say the least. But I think for me, because I am a healthcare provider, I went into instant healthcare provider mode, my instant thought. And so what did they say? What is the next step? What is the treatment? What do we need to do? So I think that was my instant thought first. And then, how do you feel? What do you want to do? How, so those were my two thoughts: is what is the next step? And then how do you feel?
And I have one more question. So I'm looking at the time here, and I want to make sure that we have enough time just to, allot to provide resources. But I haven't heard this mentioned tonight. How did the children take it? And how are they doing now?
So because we're talking about 2018, so this is about 5 years ago. They were, again, our baby was an infant. Our daughter was 6, 7 years old. She didn't know. We never did really explain to her. She knew daddy was sick, and that was about the extent that we kind of explained to her. She knows now, but during that time, she did not know the extent of what was going on with them. And he did not want her to know. So therefore, we never did explain to her what the illness was. She was a little curious as to when all of his hair came out, what was going on with his hair. But no, he never wanted her to know at that particular time. But now that she's 11, getting ready to be 12, she knows now that he has cancer. And so that was a little bit more of a challenging conversation for her to understand.
And your daughter has a little brilliant mind, so she probably was processing that entire conversation the way you and I are processing that entire conversation. So
it was, and so now, and our son is still too young because he's just 5 going on 6, so that's still a little too young for him to kind of understand. But our daughter, she understands.
Well, I appreciate you all being here tonight, and thank you all for those of you in the chat who were, putting some questions in the chat. I appreciate it. We are out of time. This has been a really, really great webinar, but we're out of time. And so, but no worries, I have some resources to provide for you. And so, as mentioned, I work for the Leukemia and Lymphoma Society. And for additional questions regarding up-to-date disease treatment support information, if you'd like to get some additional information on assisting patients and their families with financial or social challenges, you can give us a call at 1-844-955-LINK. Again, that is 1-844-955-LINK. We're open Monday through Friday, 9 to 9 Eastern time. The chat is also available Monday through Friday, 10 to 7. And even if you call after hours, you're able to leave a voicemail and someone will return your call. So you can leave a message at any given point in time of the day. So tonight, I want to thank you for joining us again for this very, very informative conversation on myeloma and its impacts in the Black community. I want to thank the National Coalition of 100 Black Women, my coalition sisters, Madam National President, Madam National First Vice President, the entire Health Committee, and on behalf of the Leukemia and Lymphoma Society, thank you for being here tonight and have a great evening.